Hi, I'm Lisa Hilbert. I work at Foster County Public Health. I am a registered nurse and also our unit administrator.
I'm Amber Cruz. I also work at Foster County Public Health. I'm a staff nurse and I also have the car seat technician certification.
And I'm Cassie Ness. I'm also a registered nurse at Foster County Public Health. So I've been a nurse for the last 10 years. Before I became a nurse, I had a lot of different jobs in healthcare. I was a CNA. I was a receptionist at a walk-in clinic, worked at a blood bank for a few years, and then worked my way through college working at the clinic as a phlebotomist, receptionist, LPN, and then an RN. And I've also worked in long-term care before I came to public health. I'm the newest nurse here. I've only been here for a few months, but I'm enjoying it a lot. Public health is nice. We get to see kind of the same people coming in for their vaccinations, especially the little kids, the babies. There's a lot of communication with the public also. Of course, with everything COVID, we do testing. We do school nursing, which has also been a lot of fun. And I'm still kind of learning about a lot of the other areas.
So I have been a nurse for approximately 12 years. I had an LPN degree for about a year when I went on for my RN. I actually was a CNA prior to that at our local hospital. I worked at our local hospital for about 17 and a half years before switching to here about a year and a half ago. One of the big reasons I was looking for a change is just hours for my family. I honestly could probably tell you in the beginning of my career, I didn't know if public health would be something I would really enjoy. I can say that in the last year and a half, I really love my job. I love who I work with. I love the hours. It can be challenging, especially now with COVID, but I feel like what we do means something. And so public health is fun. If anybody wants to choose that someday, I would highly recommend it.
I started my nursing career. I had attended the University of Jamestown, called Jamestown College at the time. Through my years in college, tried some different types of healthcare. The reason why I wanted to become a nurse was I had an experience when I was 8 years old. I was roller skating, only using one roller skate, and not a good idea. Broke my arm, and in those days, my parents actually had to leave me in a hospital alone. And so thankfully there was a nurse who came in that night as I had my arm taped to a piece of styrofoam waiting for surgery the next morning. And she sat with me and she asked me about my life. She asked me about my interests and things that were important to me. And so that really sticks in my head as a really important time in my life where some stranger came in and made me feel better. And so that's part of why I chose nursing as a career. I've been a nurse for, about 23 years now, so I guess I would be the old one in the group. But I have also done various types of nursing. Started out as a CNA while I was in college, became a nurse, started out in the hospital, wanted something a little bit more flexible for my family, so I became a clinic nurse, worked with a family practice doctor, which was obstetrics as well as just general family practice for 9 years. And then decided I wanted something a little bit more challenging and thought public health sounded like a really great idea. Public health has been extremely challenging, but has also been amazing. What we find in public health is that you come to work, they start out as coworkers, and they really become your family. We have a great group of people that work together. We look out for the whole community. We do a lot of population-based care. And so we're not just taking care of one individual at a time, we're also trying to do strategies to help prevent, promote, and protect our public. And so that's on a much more global perspective. And so, so today we're going to teach you how to administer an immunization. And so the first thing we want to do is make sure that we have all the supplies that we need in order to ensure a proper immunization into a patient.
Okay, so for an immunization, you will need to make sure you gather your supplies. You're going to need gloves, you're going to need some form of hand hygiene, whether that be hand sanitizer or soap and water. You will need a consent form filled out by the parent and signed. We also have information statements on each immunization that we give. You'll need the appropriate size needles, syringes, Band-Aids, alcohol swabs.
So when you do your hand hygiene before you do anything else, you want to make sure that whatever you use is at least 70% alcohol. When you're using alcohol-based sanitizer, you're just going to want to have enough to, when you spread it around, that it will cover all of your skin. And with these, you just keep on rubbing all over your hands, between your fingers, the whole area until it's completely dry. So for some people it may take only a few seconds, for others it might take up to 30 seconds. Otherwise, if you have access to a sink and you can wash your hands with soap and water, you could definitely do that too. At least 20 to 25 seconds of good scrubbing with the soap when you do the soap and water hand hygiene.
So the next thing that's really important for us to find out is to find a little bit of history and information about each of our patients. So we start with a demographic sheet. We're looking to know who the patient is, how old they are, if they have any medical history or any allergies to a component of the vaccine that we will be administering. It's also important for us to obtain consent from the patient or their guardian so that we know that it is okay to administer that information and that immunization to them. So we take a patient into a room and we give them that information so they can fill that out, and it will also ask about any health history that may be a contraindication or a reason why we would not give a vaccine. The second part about educating the patient is to make sure that the patient knows the medication that they're receiving and what the potential side effects or other implications can be from that. So we ask them to look through the vaccine information statement to identify any questions they may have and also help them to understand what they're receiving.
So we're going to identify our patient next, and we're going to base that off the information that they've provided for us. So if it was busy or I'm not sure which person is my patient, I would maybe ask their name and then have them confirm their date of birth to make sure that that matches and that I have the right person. Also on the form, we're going to make sure that anything that the patient answered yes to, that we address those things, such as allergies, just to make sure that whatever immunization we're giving is going to be appropriate for them. We'll make sure that we've got the right medication or vaccination for them, that we have all of the equipment, and then we move on to drawing up our medication for our patient. Also, when looking at this, there are some that are a little bit more common that people would answer yes to, and some of these are going to prevent you from being able to get your vaccination today. So for everybody out there, what do you think are some reasons that we wouldn't be able to give someone a vaccination?
I may not be able to receive a vaccination today because I'm sick.
I may not be able to receive a vaccine today because I have a severe skin rash.
I may not be able to receive a vaccination today because I had a vaccine too recently to be able to get one.
I may not be able to receive a vaccine today because I'm allergic to one of the components of the vaccine. Part of our discussion today, we want to ask you, what is the reason why people receive vaccinations? What is the purpose and the reason why people need vaccines? Basically, vaccines are given to people to help boost their immune system. Immunity helps people fight off diseases and illnesses. We want people to build up the immunity into their system so when they come in contact with a virus or some other disease that they will not contract that disease. A vaccine gives you often a small amount of the disease so your body can then build up and fight the disease. Before we prepare a medication for a patient, there's multiple items that we want to ensure for safety for our patient. Think about the things we should know about the specific medication before we administer to our patient. Important things that you would want to know before you administer a vaccine would be, what is the expiration date on the medication? Is it safe to administer today?
And you're going to find that usually somewhere along your label. On this one, it's right here. And on this vial, also kind of along the bottom.
You also want to look at each vial, make sure that the solution isn't cloudy or has sediment in it to make sure that it's proper and okay to be given as a vaccine.
And if you're using a multi-dose vial, then it's fine that you don't have the little cover on top because you've probably used it before. If you're using a single dose, you want to make sure that this cap is still on and that it hasn't been tampered with in any way.
You also want to make sure that you have the right medication. You want to make sure that it is the right amount and the right dose for the age that you're administering to. Okay.
So now we are going to draw up the medication because we've gone through all the steps to make sure that we're using the proper medication for the proper patient. So you are going to want to clean your hands. For this particular one, we're going to use a multi-dose. So because it does not have the cap, you do want to clean the top of your vial with an alcohol swab. You will make sure that you choose the correct syringe and needle size depending on the patient. You will put your needle into the top. You're going to invert and then you're going to pull back. So for this, we're going to do a half of an ml or 0.5 mLs. You want to make sure that you kind of click it because you don't want any bubbles in there. You're going to pull it back out and reapply your cap carefully, and then it is ready to be given to your patient. If for some reason somebody gets more than one vaccine, you can take a Sharpie of some sorts, and it is best to label which vaccine is in which syringe so that you do not get those mixed up.
There's two different areas that we would give an immunization in, depending on the type of immunization. The first one being one that we would give into the muscle, which is an intramuscular or IM. If you're using the deltoid muscle on your patient, you're going to make sure that you feel on the shoulder and you'll feel kind of a spot here where there's bone, and you want to go 2 finger widths down, and there's an area here, and you can almost visualize it as kind of a triangle, and you want to go kind of in the middle of that triangle. If you had a patient that was receiving maybe 4 vaccinations, 2 can be given in one arm. You would just want to make sure that those are 1 inch apart at least. And then the other type that we could do is a subcutaneous one, and that does not go into the muscle. So that would actually go in the area more the back of the arm, and that goes at a different angle also. When you're going into the arm, you go in at a 90-degree angle. If you're doing a subcutaneous shot, you're going to go in at more of like a 45-degree angle into the skin.
We are now ready to administer our immunization into our patient. And so we've had the discussions, we've made sure we have all the right equipment, all the right medication, we've asked our patient their consent and all their questions, and the patient is now ready to receive their vaccination. We always tell people it's important to try to relax, kind of let their muscles or their arms kind of turn into jello or marshmallows. So this is a great time for people to practice their deep breathing. So we take and we do our hand hygiene, okay? We go ahead and we apply our gloves. Cassie has told us how to identify the proper landmark on our patient. So we will take and we will prepare the area using a circular motion with your alcohol swab. We'll give that a second to air dry. We will take our Band-Aid and our cotton ball. Okay, we've ensured our medication, no air bubbles. So this particular medication is going to go into the intramuscular. We are going to give into the muscle. So we are going to use again that 90-degree angle. We're going to ask our patient to take in a nice deep breath. Please take in a nice deep breath and blow that out. While we're telling them to blow it out, you go ahead and insert your needle quickly and cleanly. You go ahead and you push the plunger in, administering your medication. You quickly withdraw your medication. Normally on a patient, you do not see the spray that we just witnessed with our orange. So you apply your pressure and go ahead and put on your Band-Aid. You also want to make sure, safety-wise, that you disengage your needle. So this particular one is a sliding where you take, now I can't poke myself, and I find my sharps container and I dispose properly of that. I have just administered my vaccine to my patient. I've disposed properly of my sharps, and I need to now remove my protective equipment. I'm ensuring that my patient is okay. I'm going to ask my patient to stay for a few minutes. I go ahead and we have a glove technique where you basically take and you pull your gloves inside out so that the dirty stuff all stays away from you. And then you can remove your gloves, discard those into the trash, and then perform hand hygiene.
Once they're done receiving their vaccine, we do ask the patient to stay in our office for 15 minutes so that if they have any type of reaction, they are still here with us. When the 15 minutes is up, if they are feeling well, they are free to go. While they are waiting, if they did get an immunization that requires a second dose, we do take that time to schedule them for their next appointment so that does not get missed.
So once our patient leaves the room, then we want to sanitize the room so that it's ready for the next patient. We're going to use an approved sanitizer. In this case, we're going to use the Cavi wipes. And we're just going to wipe down any surfaces in the room that the patient may have touched, whether it's tabletops, chairs, things like that. And then, of course, we're wearing gloves because these cleaners are tough on the skin, so you want to make sure that you do have gloves when you do the sanitizing. And once everything is wiped down, we take our gloves off. We do our hand hygiene again before we leave the room, and then the room's ready for our next patient.
So I just want to let you know that here in Foster County, which is located in Carrington, should you ever be interested in learning more about being a nurse or what public health is all about, please know this is an invitation to give us a call and come on over and spend some time with us. We'd love to have you around. Thanks for your time and good luck.